to do research in relation to nursing work using a complexity theory framework or a framework that captured some of the concepts in complex adaptive system theory, I found what is called the sharp and blunt end model. And it's sharp and blunt end, and also explains work at the sharp end. And what that model does is it doesn't delimit work to a list of tasks, or it doesn't limit work to what's on a job description. What the framework does, it captures work when you're in it, what it's like to be in it, with concepts important for what makes work difficult or what makes work challenging. So at the sharp end of the framework, there's the nurse, let's say at the bedside, and it's clear from the framework that this sharp end is in constantly evolving situations. It's not a static laboratory type sterile situation they're in, so things are evolving. And at the sharp end, which is the point of a triangle, you've got the left side of that triangle, which represents concepts related to what makes work difficult. So it's the obstacles that you run into that make for the not perfect situation. It's the goal conflicts you run into, meaning I want to give pain medication, but I also need to do this other task, and so somebody's going to have to wait. So you've got a goal conflict there. So you sort of trade off one goal for another to meet it. So anything that makes work difficult or doesn't portray the perfect situation would be on the left side of that sharp end model. And it's the barriers or difficulties around work. On the right side of that triangle, though, at the sharp end, are all the strategies, according to the framework, that people use to deal with the left side of the triangle, or the barriers or the obstacles, to make the work that they're actually doing turn out exactly the way it should turn out 99.9% of the time. So it's about real work in real context and how people manage it. So having found that framework and getting that from the colleagues that work at the VA in Cincinnati, that became the whole framework I use now for doing nursing research to try to understand nursing. So when we did our first study, what we wanted to identify about nursing work was what were those barriers, things that made work difficult for nurses when they were providing nursing care. And then on the right side of the triangle, what were those strategies they used to deal with those barriers when they were in those situations. And then one thing I didn't say yet is in the middle of that triangle at the sharp end is what's going through their head. How are they making decisions related to the left side barriers, deciding what the strategies are they're going to use on the right side, and then what are decisions they're making and what influences those decisions. So when we did our first study on nurses working on medical surgical units, that's exactly what we looked for. We observed their actual work, and we did interviews with them, asking them about what they were thinking while they were doing it. And what came out of that study was a list of things that were barriers or obstacles or things that made work difficult. We came out with strategies that they were using to deal with those. And we came out with the type of decisions they were making and the type of thoughts and factors that were influencing those decisions while they were in it. So for me, I felt it was a perfect way to use complex adaptive system theory, a framework that reflected complex adaptive systems theory, to identify nursing work in the context of real work and all of those system issues and things about the nurse themselves that came together and resulted in work so that we could describe it. So that's how we've used that model. About using that model, which has been interesting, is, and it was very interesting for nursing education, is that when we identified some of the strategies they were using to deal with the barriers, it was such an aha moment And actually, it became more real to me when the person who was helping with my research was an expert critical care nurse and an excellent educator, helping with my work. And she had taught longer than me, because remember, I just started teaching in 1998. She looks at the right side on the list that are the strategies nurses use to manage and says to me, we don't teach nurses how to do any of those things in the School of Nursing. So here we are in the School of Nursing teaching the perfect this procedure, the perfect that procedure, all in the context of linear thinking and lab, and not at all preparing them to deal with a complex adaptive system, which is exactly what they were going to be working in once they got out and applied for a job. So the framework has helped us to be able to articulate and describe the work in a complex adaptive system versus just focusing on, for nursing education, what they should know about how to do it perfectly.